Have you ever felt it? That sharp, almost electric pain shooting from your lower back, maybe through the hip, right down your leg? Or that feeling where just, getting out of bed feels like this monumental task you're definitely not ready for?
Yeah, a real struggle.
Well, if you're, say, over 60 and you're nodding along thinking, yeah, that sounds familiar, you are absolutely not alone. This kind of pain, what we often call sciatica, it affects, over 40% of adults sometime in their life?
It's incredibly common. And here's where it gets really interesting, actually. Because what so many people are told about that pain, that it's just normal aging or simple wear and tear, well, that's dangerously incomplete.
Right. That's the hidden truth we really want to dive into today. Our mission for this deep dive is to unpack the real culprits, the often overlooked ones behind sciatic pain.
Exactly. And also reveal the critical warning signs you absolutely must not ignore.
And maybe explain why some of the common treatments might actually be making things worse in the long run. Precisely. We're going to try and decode what your body has genuinely been trying to tell you all this time. We'll look at some surprising facts about, the longest and thickest nerve in your entire body.
It's about as thick as your thumb, right?
Yeah, roughly as thick as your thumb. And believe me, when this massive nerve gets irritated, it doesn't whisper, it screams.
Okay, so this deep dive is basically your shortcut to getting properly informed about a condition that's just so often misunderstood.
That's the goal.
So let's start unveiling this mystery then. The sciatic nerve. You just said, longest and thickest in the body. That's quite something. And yet conventional medicine often seems to lean so heavily on that wear and tear idea. If that's not the whole story, what are these hidden culprits they're missing?
Right, that just part of getting older narrative, it really misses the mark. Fundamentally, there are three major hidden culprits we see time and again. First is spinal degeneration, but not just wear and tear. I call it the silent destroyer.
See, by age 60, your spinal discs, they've lost a significant amount of their original water content. We're talking maybe 30, even 40%.
Wow, that much.
Yeah. And this isn't just normal aging, it's more like cellular dehydration, and it creates this domino effect. When the discs shrink and harden, they can bulge, they press on nerve roots, they trigger inflammation.
Okay.
We've seen patients like Martha, 67. Her doctors told her for 3 years her increasing leg pain was just age-appropriate disc degeneration. Completely missed the severe dehydration that was accelerating the whole process.
And what happened when that was addressed?
Once we focused on that cellular nutrition and hydration, her pain decreased by 70% in about 6 months.
70%. So if it's the cellular dehydration driving the degeneration, does that mean focusing only on the wear and tear, like many conventional treatments do, is basically missing the root cause?
Exactly. It implies true healing has to go deeper than just looking at the structure on an MRI.
So what kind of interventions actually do address it at that cellular level?
Well, you'd be looking at things like systemic hydration protocols, anti-inflammatory nutrition, specific cellular support nutrients, not just, rest or pain meds.
Makes sense.
Now, culprit number 2 is piriformis syndrome. This is truly the muscle that can betray you.
The piriformis. Okay, where is that exactly?
It's a muscle deep in your buttock, sits right over your sciatic nerve. And for maybe 20% of people, the sciatic nerve actually runs through this muscle.
Through it? Wow.
Yeah, so as we age, maybe become less active, this muscle can get tight, spasmed, and literally squeeze the sciatic nerve like a vice.
Ouch.
And the tragedy is, many seniors are incorrectly told they have herniated discs when the real problem is this muscle dysfunction, which, importantly, could often be addressed with targeted therapy, not surgery.
Hearing you talk about piriformis syndrome, it reminds me, I had this period where I thought I had a serious back issue. Turns out it was just an incredibly tight muscle causing nerve referral. It's really eye-opening how these things can mimic each other.
It really is.
How common is that kind of misdiagnosis? And what can someone do to, make sure they're getting the right assessment specifically for piriformis syndrome?
It's surprisingly common.
Right.
Really, a thorough physical exam with specific muscle tests that provoke the piriformis, plus a detailed history, what makes the pain better, what makes it worse. That's often far more telling than an MRI in these cases.
Okay, so the hands-on exam is key.
Absolutely. Which brings us to the third culprit in this hidden trio, the inflammation cascade.
Inflammation. We hear that word a lot.
We do. And chronic low-grade inflammation is sadly almost epidemic in adults over 60. This isn't just localized, it affects tissues throughout your spine. When these inflammatory chemicals, these cytokines, build up around nerve roots, the nerves become hypersensitive.
So like easily irritated.
Exactly. Even minor pressure, say from a disc change that wouldn't bother a younger person much, can cause severe pain in an inflamed environment. It's not just the structural change itself, but the body's inflammatory response to it.
Okay, so if these are the real underlying issues, the degeneration driven by dehydration, the tight piriformis muscle, this inflammation cascade, why do so many conventional treatments seem to fall short? Why aren't they working long-term for so many people?
Well, think about what they usually involve. Often, it's masking symptoms with pain medications, right?
Yeah, painkillers.
Or offering generic exercises that don't target the specific problem, like a tight piriformis versus a compressed nerve root.
Right, like a one-size-fits-all sheet of exercises.
Exactly. Or maybe temporary relief with steroid injections, which reduce inflammation but don't fix the cause. Or ultimately recommending surgery that fixes a structural issue seen on an MRI, but often ignores the underlying functional problems, the inflammation, the muscle imbalances.
So they're treating the smoke, not the fire.
Precisely.
Yeah.
It's like mopping the floor around a leaky pipe without actually fixing the leak.
That's a great analogy. Okay, so if conventional treatments are mostly just mopping the floor, what are the long-term consequences for someone who relies only on those approaches, someone who doesn't fix the leak?
Well, the biggest risk, honestly, is that the underlying issue just continues to worsen. This can lead to more entrenched chronic pain, potentially permanent nerve damage over time, and often this cycle of increasing medical interventions, stronger meds, more injections, maybe repeat surgeries that never truly resolve the root problem.
It sort of becomes a chronic condition by default then.
That's a good way to put it, yeah. Now, it's important to say, while most sciatica isn't immediately dangerous, there are some critical warning signs. Red flags that mean you need immediate medical attention. We should probably cover those.
Absolutely critical, yes. You must seek immediate medical attention, like go to the ER if you experience any loss of bowel or bladder control. That's number one.
Crucial.
Also, progressive leg weakness, meaning your leg is getting noticeably weaker over days or weeks. Numbness in the groin or inner thigh area, sometimes called saddle anesthesia. Pain that occurs in both legs simultaneously, not just one.
Yeah.
Or a fever accompanied by back pain.
That's a really important list. Any of those symptoms could indicate something serious, like cauda equina syndrome, which needs emergency treatment to prevent permanent damage.
Definitely not things to wait on.
Okay. So we've talked about the hidden culprits, why some treatments fail. Let's move into decoding what your specific symptoms might be telling you, because every symptom pattern is a clue, right?
Precisely. Yeah, after treating thousands of seniors, you definitely start to see distinct patterns emerge. And these patterns can reveal exactly what's likely going wrong. We generally see 4 main sciatica symptom patterns.
Here, what's the first one?
First is the lightning strike. This is that classic, sharp, electric shooting pain. Zings from your back, through the buttock, down the leg, often feels like a jolt.
And what does that usually indicate?
It often means classic nerve root compression, usually at the L5 or S1 level in the lower spine. And the location gives clues too. Pain going towards the big toe often points to L5 nerve root involvement. Pain towards the little toe, more likely S1.
Interesting how specific that can be. Okay, what's the second pattern?
The second is the deep ache. This isn't usually sharp or electric. It's more of a constant gnawing pain, often felt deep in the buttock or hip area. It's frequently worst when sitting for long periods, like in a car, but might feel a bit better when you're walking around.
Ah, and that sounds like...
That's a classic sign of piriformis syndrome. The ache comes from that muscle spasm compressing the sciatic nerve deep in the buttock. Key signs are often worse, sitting, climbing stairs, but relieved by walking.
Got it. Okay, pattern number 3.
This one's called the creeping numbness, and it can be particularly unsettling for people.
Sounds like it. What does that feel like?
It feels like your leg is falling asleep, or your foot feels thick and clumsy. Maybe you have trouble feeling the gas pedal properly when driving. This is often the most serious pattern functionally, because it means the nerve isn't just irritated, it's actually losing function. There's a risk this could become permanent.
So real warning signs within that pattern.
Critical signs to watch for here include foot drop, where you can't lift the front of your foot properly, or numbness, specifically between the toes, or a loss of temperature sensation, like you can't feel hot or cold properly in the affected area.
Okay, that definitely warrants close attention. And the final pattern?
The fourth one is the burning fire.
Evocative name.
It's exactly what it sounds like, intense burning sensations down the leg.
Yeah.
Sometimes people say it feels like hot water running down their leg, or like the skin itself is literally on fire.
And what does it usually signify?
This indicates neuropathic pain. The nerve itself is inflamed and hypersensitive, firing off pain signals abnormally. It's often associated with skin that feels overly sensitive to touch. It might be worse at night, and sometimes comes with muscle cramps as well.
Wow, it's quite remarkable how distinct those patterns can be. It really provides a kind of roadmap to what's happening inside.
It really does.
Does sciatica also tend to progress through predictable stages if it's not addressed effectively?
Yes, it often does. We typically see a 4-stage progression, especially when those underlying factors aren't dealt with. Stage 1 is what we call the warning phase.
Okay, what does that look like?
This might last weeks, maybe months. It's characterized by things like occasional morning stiffness in the lower back, or maybe mild hip or buttock discomfort after sitting for a while. It's often subtle. This is actually the most easily treatable stage, but sadly, it's the one most often ignored or dismissed.
People just think, oh, I slept funny, or I'm just getting older.
Exactly. Then comes stage 2, the irritation phase. This can last for months. Now you have distinct leg pain, maybe sciatica, that comes and goes. It starts interfering a bit more, maybe making it difficult to find a comfortable sleeping position. At this point, the nerve is definitely irritated, but usually not permanently damaged yet.
Still a good window for intervention then.
Absolutely. But if it progresses, you hit stage 3, the inflammatory phase. This can last months to years. Now, the pain is often constant. It's significantly affecting daily activities, work, hobbies. Sleep is usually very disrupted. Without proper intervention here, permanent changes in the nerve and surrounding tissues can start to set in.
And the final stage?
Stage 4, the chronic phase. This can last for years or indefinitely. Here, you often see muscle weakness becoming apparent. Maybe the calf muscle shrinks or you have that foot drop. Constant numbness or tingling is common. The risk of permanent nerve damage is quite high at this stage.
That's a sobering progression. Okay, so given these patterns and stages, what tests are actually essential to figure out what's going on versus tests that might be commonly done but maybe aren't always necessary?
Right. Well, you absolutely need a comprehensive physical examination. That includes specific nerve tension tests, muscle strength testing, checking reflexes, sensation. That clinical evaluation is paramount.
Okay, what about imaging, MRI?
An MRI is important, yes, but typically it's most useful after about 6 weeks of conservative treatment haven't worked. Doing it too early can sometimes show age-related changes that aren't actually the cause of the current pain, leading to unnecessary worry or even inappropriate treatment.
That makes sense. What about other tests? EMG.
X-rays. EMG, or nerve conduction studies, can be very valuable if there's significant numbness or weakness to assess nerve function directly. What's often unnecessary, especially early on, are X-rays. They're great for looking at bones, but they completely miss soft tissue problems like disc herniations or piriformis issues, which are common causes of sciatica. So X-rays aren't that helpful here, not usually for the primary diagnosis of sciatica itself. CT scans might be used if an MRI isn't possible, but MRI is generally preferred for visualizing nerves and discs and routine blood work. Usually unnecessary unless there's a suspicion of an underlying systemic disease like an infection or inflammatory arthritis contributing to the pain.
It reminds me of something a colleague, Dr. Lisa, often says. I've seen patients with terrible-looking MRIs who have minimal pain and others with mild findings who are in agony.
That's so true.
Symptom severity doesn't always match the imaging. The clinical evaluation, talking to and examining the patient, is absolutely irreplaceable.
Couldn't agree more. It's about the patient, not just the picture on the scan. Now, are there any typical differences in how sciatica presents or progresses in men versus women, particularly after age 60?
Yes, there are some general trends we observe. Women, for instance, often tend to report more burning-type pain, that neuropathic pattern we discussed.
Interesting.
There can also be a greater hormonal impact, particularly post-menopause, affecting tissue health and inflammation. Women also generally have a higher statistical risk of osteoporosis, which can lead to compression fractures, contributing to nerve issues, and they seem to experience piriformis syndrome a bit more frequently than men.
Okay. And for men?
Men, on the other hand, tend to report more mechanical type pain, the lightning strike pattern perhaps. They might have greater effects from years of occupational wear and tear depending on their work history. Statistically, they have a slightly higher risk of developing spinal stenosis, which is a narrowing of the spinal canal. And perhaps, unfortunately, sometimes we see a bit more resistance to seeking early treatment among men.
The tough it out mentality, maybe.
Could be part of it, yeah. So understanding these potential differences can sometimes help tailor the approach, too.
So it sounds like understanding your specific pattern, lightning strike, deep ache, numbness, burning fire, is absolutely key. You really can't just treat all sciatica the same way, can you?
Absolutely not. It's critical. If you have that lightning strike pattern, the primary focus needs to be on strategies to reduce that mechanical nerve root compression. Things like specific directional exercises, maybe traction, postural correction. If it's the deep ache, characteristic of piriformis syndrome, the focus has to be on addressing that muscle dysfunction, targeted stretching, soft tissue release, strengthening opposing muscles, and managing inflammation around the muscle.
Right. And the numbness.
If it's the creeping numbness, that requires urgent, comprehensive evaluation to figure out the cause of the nerve dysfunction and intervene quickly to prevent permanent damage. Time is often of the essence there.
And the burning fire.
For the burning fire, the treatment needs to target that neuropathic pain and nerve inflammation directly. Sometimes specific medications are helpful here, along with nutritional strategies to support nerve health and calm down the nervous system. Your pattern truly reveals the specific mechanisms at play, and treatment must be tailored accordingly.
That makes so much sense. Which brings us to another really almost shocking truth you mentioned earlier. How two people can have identical MRI findings, say, the same size disc herniation, yet have completely different outcomes.
Yes.
One person recovers fully in 6 weeks. The other suffers for years. And he said the difference often isn't the severity of the disc issue itself, but what you call their risk factor profile. Can you unpack that? What are these critical risk factors that are such game changers?
Absolutely. This is hugely important. The first major risk factor is what I call the inflammation time bomb.
Okay, the time bomb.
This refers to chronic systemic inflammation throughout the body. When your whole system is already inflamed, even a minor nerve irritation in your back can trigger a massive, disproportionate inflammatory cascade locally. Your system basically overreacts, like a hypersensitive smoke alarm going off just because you burned some toast.
So, small trigger, big reaction. How would someone know if they have this hidden systemic inflammation?
There are often subtle signs. Things like morning stiffness that lasts for 30 minutes or more after waking up, persistent fatigue that isn't really relieved by rest, maybe digestive issues that seem to be worsening with age, or sleep disruption without an obvious cause. And the stats are pretty stark here. Adults over 60 who have elevated inflammatory markers in their blood work are about 4 times more likely to develop chronic, persistent sciatica compared to those with low inflammation.
4 times, wow.
Yeah, we saw this clearly with a patient, Eleanor, 68. Her sciatica just wouldn't quit for 8 months, despite a relatively normal MRI. But when we dug deeper, she had significant signs of systemic inflammation. Once we addressed that, primarily through dietary changes, her pain resolved within weeks.
That's powerful, just addressing the body's overall inflammation level. Okay, what's the second critical risk factor?
The second one is muscle imbalance syndrome. Decades of modern living, lots of sitting, maybe less varied movement, create these really predictable patterns of imbalance.
Like what kind of patterns?
Typically, we see weak, deep core muscles, the ones that are supposed to stabilize the spine. Tight hip flexors from all that sitting. Weak glute muscles, the buttock muscles that no longer properly support the pelvis. And then often overactive lower back muscles that are trying desperately to compensate for the lack of core and glute stability.
So some muscles are weak and lazy, others are tight and overworked.
Exactly. And it creates instability and poor movement patterns that put stress on the spine and nerves. Here's a simple test you can try. Can you stand on one leg for 30 seconds with your eyes closed?
Uh-oh. Sounds tricky.
It is for many people. If you wobble significantly or have to put your foot down quickly, it likely indicates you have significant balance and muscle imbalances that could be contributing to sciatic pain or put you at risk. These imbalances really compound over time. A 30-year-old might get away with it, but by 60 or 70, these patterns often break down and lead to pain.
Okay, that makes sense. Inflammation time bomb, muscle imbalance syndrome. What's the third critical risk factor?
The third is metabolic chaos. This primarily relates to blood sugar instability and insulin resistance, which are increasingly common.
How does blood sugar affect the sciatic nerve?
Well, your nerves are incredibly metabolically active. They need a constant, stable supply of energy, and they're highly sensitive to fluctuations in blood sugar. So when blood sugar spikes and crashes, it creates inflammatory compounds that directly irritate nerves. Insulin resistance, where your cells don't respond well to insulin, impairs the nerve's ability to repair themselves. Nutrient deficiencies, often linked to poor metabolic health, can prevent proper nerve function. And poor circulation, also common with metabolic issues, limits the delivery of oxygen and nutrients needed for healing.
Are there warning signs for this metabolic chaos?
Yes. Things like experiencing energy crashes 2 or 3 hours after eating a meal, craving sweets frequently, finding it really difficult to lose weight even with reasonable effort, or, interestingly, often waking up between 2 and 4 a.m., which can sometimes be linked to blood sugar dropping overnight.
Huh, didn't know that connection.
And clinically, we definitely see it. Seniors who have a hemoglobin A1C level that's a key blood marker for long-term blood sugar control above 5.7%, which indicates prediabetes or diabetes, they tend to take about 60% longer to recover from sciatica episodes compared to those with stable blood sugar.
60% longer, just based on blood sugar control. That's significant.
It really is. These risk factors, inflammation, muscle imbalance, metabolic chaos, they truly determine how resilient your body is and how quickly you can bounce back from something like sciatica.
So how do we assess our own risk based on these factors?
We can sort of categorize it. If you identify with, say, 2 or 3 of these major risk factors being present, maybe you have chronic inflammation signs and significant muscle imbalances and signs of metabolic issues, you'd be considered high risk.
And what does high risk mean for recovery?
It means recovery times could potentially stretch from 6 months to over 2 years, even with treatment. And there's probably an 80–90% chance the sciatica will come back unless those underlying factors are comprehensively addressed. Intervention needs to be thorough.
Okay. What about moderate risk?
Moderate risk might be having 1 or 2 of these factors present. Here, recovery might take, say, 6 to 16 weeks with the right kind of treatment, but there's still a pretty significant recurrence likelihood, maybe 40–60%. So targeted intervention on those specific risk factors is still really important.
And low risk?
Low risk would be having 0 or maybe just 1 of these factors significantly present. In these cases, recovery often happens much faster, maybe 2 to 6 weeks with basic appropriate care, and the recurrence risk is much lower, perhaps only 10–20%.
So these risk factors are hugely predictive. If someone realizes they do have these risk factors, what's the priority for intervention? Where should they start?
Good question. Generally, priority 1 goes to tackling the inflammation and the metabolic factors. Why? Because these affect healing at the most fundamental cellular level. You need to calm the system-wide fire and ensure the nerves have the stable energy and nutrients they need to repair.
Okay, inflammation and metabolism first. Then what?
Priority 2 is usually addressing the movement patterns and muscle imbalances. This deals with the mechanical stresses contributing to the problem. So, targeted exercises, posture correction, improving stability.
Makes sense.
And priority 3, which is still very important, is stress management. Chronic stress significantly impacts pain perception and can worsen inflammation. So incorporating stress reduction techniques is key. We consistently see that patients who systematically address their specific risk factors in this kind of priority order recover 3 to 5 times faster, and they rarely have recurrences.
3 to 5 times faster. That's incredible. Which brings us to something you mentioned earlier that sounds quite concerning, the false recovery track. Can you expand on that? What is that?
Yes, this is absolutely critical to understand. Many people experience what feels like recovery because the acute, intense pain subsides, maybe with some rest or basic treatment.
Right, they feel better, so they think they're cured.
Exactly. But the underlying risk factors, the inflammation, the muscle imbalances, the metabolic issues, remain completely unchanged. They haven't fixed the leaky pipe, they just finished mopping the floor for now.
Oh.
So what happens? Within maybe 6 to 24 months, they often find themselves right back where they started, or frequently with an even worse episode of sciatica, because the underlying vulnerability was never addressed.
That sounds incredibly frustrating.
It is. So true recovery isn't just about getting out of the current pain episode. It's about transforming those underlying risk factors so that sciatica doesn't just keep coming back. Addressing symptoms without changing risk factors is, like we said, trying to mop up a flood while the sink is still overflowing. It's futile long term.
Okay, that's a really important distinction, the false recovery trap. So knowing all of this, the hidden culprits, the symptom patterns, the risk factors, the trap, what is the path to genuine, lasting relief?
Well, the most important message, I think, is one of hope. Your body possesses an extraordinary capacity for healing, even after years of chronic pain. We've seen it countless times, seniors who honestly thought their active, vibrant days were long gone, who discover renewed energy and vitality they didn't think was possible.
So it's not necessarily a life sentence?
Definitely not. The key insight is that your recovery journey isn't just about stopping the pain signals. It's fundamentally about reclaiming your life, your function, your vitality. You mentioned Maria earlier.
Yes, Maria's 69.
Right. At 69, she could barely walk to her mailbox because of severe, debilitating sciatica. She'd seen 3 different doctors, and the consensus was leaning towards surgery as her only real option left.
Wow. And what happened?
8 months later, after embarking on a comprehensive approach that addressed her specific risk factors, inflammation, significant muscle imbalances from years of sedentary work, she was hiking with her grandchildren.
That's incredible. From mailbox to hiking trails, what changed?
She didn't just treat the symptoms. She fundamentally transformed her entire health foundation. She addressed the inflammation through nutrition, rebuilt her core and glute strength, improved her metabolic health. It wasn't just about the sciatica. It was about rebuilding her overall resilience.
So it sounds like it's not necessarily a quick fix, but more of a journey of transformation.
That's exactly what it is. And that journey might look something like this, perhaps over, say, 12 weeks as a general guide. Weeks 1 and 2 are often about laying the foundation. Gentle daily movement, maybe just walking or swimming if possible. Starting on anti-inflammatory nutrition, focusing on whole, unprocessed foods, cutting down on sugar, processed oils, things that fuel inflammation, and incorporating some basic stress reduction like deep breathing or spending time in nature.
Okay, gentle start.
Then weeks 3 to 6 are about building momentum, gradually increasing activity levels as pain allows, really focusing on improving sleep quality because that's critical for healing. Starting targeted exercises for your specific muscle imbalances or nerve issues, this needs to be personalized, and consciously improving posture throughout the day.
Getting more specific now.
Exactly. And then weeks 7 to 12 are really about transformation and solidifying those changes. Developing a more comprehensive movement practice that you enjoy and can stick with. Fine-tuning nutrition specifically for nerve health. Certain B vitamins, magnesium, healthy fats become important. Mastering stress management techniques. And crucially, building a long-term maintenance plan so these healthy habits stick, preventing recurrence.
That sounds like a comprehensive plan. And I guess it's important to add that people should always consult their doctor, right, before making big changes.
Absolutely. Especially if you have existing medical conditions or are on medications. This kind of guidance is meant to complement, never replace, professional medical care and advice from your own healthcare provider.
Good point. And while we've covered so much ground on understanding and addressing sciatica, we should probably reiterate those emergency warning signs one more time, just because they're so critical.
Yes, definitely worth repeating. Seek immediate medical attention. Go to an emergency room if you experience loss of bowel or bladder control.
Progressive leg weakness, where your leg is getting noticeably weaker.
Numbness in the groin or inner thigh area, that saddle region.
Pain in both legs at the same time.
Or a fever occurring, along with the back or leg pain.
Don't wait on those. They are critical signals from your body.
Absolutely. So, this whole deep dive really shows us that sciatica, for most people, isn't some inevitable life sentence or just a normal part of getting older.
Right. It's more like a specific message from your body, isn't it? Signaling that changes are needed.
Exactly. And that a true lasting recovery is really about transforming those underlying risk factors we talked about. The inflammation, the imbalances, the metabolic issues, not just chasing or masking the symptoms.
And reminding everyone listening, your body really does have this extraordinary healing capacity. Even if you've been dealing with pain for years, you likely have much more control over your health and recovery than you might realize.
Absolutely. So perhaps a final thought to leave you with as you reflect on all this. If your pain has a specific pattern, if it feels like that lightning strike, or the deep ache, the creeping numbness, or the burning fire, and if you recognize it might be tied to those unique risk factors like the inflammation time bomb, muscle imbalance syndrome, or metabolic chaos, what old beliefs about aging or about treatment might you need to let go of? What do you need to release to truly hear what your body is telling you and start taking the steps needed to reclaim your vitality? Just like Maria did, going from barely walking at 69 to hiking with her grandkids. What could that look like for you?